Explore the history of scoliosis. Scoliosis is a spinal condition that's been around for ancient times. Scoliosis was first described by a Greek physician, Hippocrates. The name scoliosis comes from the Greek word scolios, which means curve or bent, and it was coined in approximately 200 AD. Scoliosis is the development of an unnatural sideways curvature that also rotates into the concavity of the scoliosis. This makes it a true three-dimensional condition. Scoliosis is also a progressive condition, meaning it is its very nature to worsen over time. The condition's severity is typically determined by measuring a Cobb angle, known as the gold standard in assessing scoliosis and really determining treatment options that could be associated with that patient severity in mind. Now, when we look at a Cobb angle is typically determined during a scoliosis x-ray, and it tells the doctor how far out of alignment the scoliosis is. The higher the Cobb angle, meaning the greater the number in degrees, represents the more severe the condition is. A mild, moderate, severe, or very severe scoliosis is typically diagnosed by the size of Cobb angle. The Cobb angle method was initially invented in 1948 by Dr. John Cobb. Scoliosis was initially treated trying to use scoliosis bracing, and this was formed in 650 AD by trying to tie patients to wooden sticks to try to straighten up their spine. The actual first brace was metal, and it was created in France in 1575. Fortunately, scoliosis bracing has come a long way from these metal braces and using sticks. And in fact, modern scoliosis bracing represents a culmination of what we learned about scoliosis and actually how it responds to specific corrective forces to actually reduce and manage scoliosis more effectively. Modern conservative bracing tends to favor more corrective-style bracing like the Scoli Brace, and the Scoli Brace was first released in 2012. Now, scoliosis bracing was initially the precursor for traditional treatments and existed way beyond spinal fusion. It wasn't later into scoliosis treatment has evolved where now scoliosis surgery has become more mainstream. And actually over time, as scoliosis surgery became more mainstream and the complications associated with scoliosis surgery, this is where the scoliosis conservative treatment, more scoliosis bracing and therapy has kind of come back. And when we look at scoliosis surgery, we look at something called spinal fusion. And traditional scoliosis treatment commonly funnels patients towards spinal fusion by doing very little to prevent progression. Before patients know their spine is progressing into severe calcification, and before they can actually make decisions to try to stop the curve from progressing, very often they progress right through any type of treatment options that could exist, and they're already in that severe category, and this is when they're told they need scoliosis surgery. The first surgical attempt at stopping scoliosis progression through surgery was conducted by a French surgeon, Jules René Guérin, in 1865, and it was unsuccessful. With the invention of spinal x-rays in 1895, it was actually possible to see what was happening around the spine and seeing the deviations and actually start measuring them. In 1950, this is where Dr. Paul Harrington performed the first spinal fusion by attaching a single metal rod to the spine, and it was successful at slowing down progression of idiopathic adolescent scoliosis. French surgeons Coutrel and Dubuisset evolved the surgery in the 80s by introducing double rod and pedicle screws to help hold the spine into a straighter position. This hardware is still used today in modern spinal fusion surgeries. Now, modern scoliosis treatment approaches have now become leaning more towards conservative options, and these are the risks that are associated with scoliosis surgery and the long-term effects, how they're unknown and how they can influence bodies and people's health and well-being as they age with these rods in people's spines. So the rise of this conservative treatment has now come back where patients are now seeking bracing and therapy and rehabilitation as opposed to seeking out scoliosis surgery. And what's great is that these modern conservative treatments now actually don't have a goal that's limited in just trying to slow down progression. The goal now is actually by reducing and correcting the scoliosis by making it straighter. Now, conservative treatment has also moved into a more proactive stance, meaning a modern conservative treatment treats scoliosis closer to the time of diagnosis as opposed to letting curves worsen over time time to where they become more severe, where surgical options become more integrated into the patient's treatment options. Now, conservative treatment normally integrates many treatment options. It's not just limited to spinal bracing or exercises or therapy or rehabilitation or chiropractic care. Normal modern conservative treatment integrates all these treatments in a very coordinated way to try to produce the best results for the patient. So what I find very interesting is how the ebb and flow of scoliosis treatment initially started off with conservative, was kind of replaced by scoliosis surgery, and now conservative treatment is now starting to come back and starting to dominate the scoliosis treatment situation, because patients are not looking forward to going under spinal scoliosis surgery, where it involves fusion and such an integrated hardware system for the rest of your life. So when we look at the history of scoliosis, we know the treatment extends back to the ancient times, and the condition itself is very, very complex. Here at Scoliosis Reduction Center, the goal of treatment is to proactively work in preventing progression and not allowing the scoliosis condition to increase. And when it increases, the symptoms escalate and the treatment is harder. So we always recommend the younger the patient, the smaller the curve, the better the results. So we recommend treating curves as close to the time of diagnosis, and this prevents progression, which can lead to more invasive surgical treatments in the future. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.